Hello there, this is James, and we're going to do the last of our movement analysis. Actual kind of key learning here, and we're going to focus on the knee and the ankle. Okay, so we're now looking towards the lower limb and the lower part of the leg, the knee, and later on the ankle. So let's start over here. First of all, realize that this is an image of the right knee, and we know that because we can sort of see the fibula, which is always on the outside of the leg on this side here. So we have the right knee here. This here would be the inside of the knee. This here would be the outside of the knee. So just make sure you familiarize yourself with that. Again, we have this huge, long, strong femur bone which is running down from the upper body here to articulate at the knee. We also have this large bone, long bone coming from the lower body, which of course is our tibia. And I've already referred to the fibula. Let me just write that in for you. The fibula here, which runs alongside the tibia. But the only thing I'd say about the fibula is we don't say that it articulates at the knee. Later when we talk about the ankle, it does. But just be aware that it's there, though not articulating. And the other bone that you should have an awareness of is this bone here, which of course is your kneecap or your patella. Now there is some dispute about whether the patella actually articulates at the knee or not. But as you'll see in a few minutes' time, it's really important you have an awareness of that bone because we have numerous muscles inserting onto patella and then passing down through the patella onto the tibia. So it's important you're aware of it. The other thing that kind of, you see it so clearly in this image over here is that the knee is a hinge joint. Okay, it is a hinge joint and it is made up of the articulations of the bones of the femur, the tibia, and arguably the patella. And of course, if it's a hinge joint, it is monoaxial. It moves through one single plane. In other words, it extends and it flexes. That is all that it does. And you can see that on this image. It's just designed perfect for bending and straightening. You can see from the curvature of the surfaces as they meet each other. Just recall that these textures here, here, and here, and again you can see them just here and here, this is all cartilage. Okay, so let's not forget that cartilage covers the ends of the bones, very slippery, smooth, robust, strong texture that allows for smooth movement across the two. And another point I wanted to make with you is that of course we have ligaments. Let's just address the idea of ligaments. We have ligaments which stabilize this joint. So we do have some ligaments which cross in the middle. They're called your cruciate ligaments, but we also have what are called your medial and lateral collateral ligaments, which actually cross the outside on each side of the knee, and these ligaments actually stabilize the joint and prevent it going anywhere that it shouldn't, including sideways, right? That's not good if that happens. So these medial and lateral collateral ligaments prevent the joint from doing anything other than hinging, flexing, and extending. So, of course, because it is a hinge, we are interested in the process of flexing or flexion, which, of course, in this case is going to be the bending of the knee, and we're interested in extension. Let's see if we can look at the muscles which cause these movements to occur. Incredibly common within sporting performances. So let me just drag you down slightly. So here again, we have the right leg. This is the right leg. And this, of course, is also the anterior view or the frontal view, the anterior view, a word that's going to become very relevant in a few moments' time. This is the anterior view. And what we've got here is I've got an image of 3 of the 4 quadricep muscles. Now, it's useful to know the word quadricep. Quadricep is the muscle group name of the muscles which extend the knee, that straighten the knee. Okay, but I want you to know the 4 muscle names. So the first one I want you to have an awareness of is this muscle here. And look where it inserts. It inserts down onto the patella, and it has its origin up here on the greater trochanter, which remember I referred to in the hip video. So with this one, this is what we refer to as your vastus lateralis, which I'm going to make a point of spelling accurately. Lateralis. Okay, vastus lateralis. Okay, so this is this muscle. Think about it straightening or contracting and bringing that knee upwards, bringing this lower leg tibia upwards and causing extension, straightening. I want you to be aware that this next one in the middle here, that was pretty shocking, that this one here This one here, again, is going to contract and pull upwards, again inserting down onto the patella. This one is what we call your vastus. Your vastus intermedius, the vastus intermedius. And this, of course, is intermedius because it's in the middle. Lateralis, lateral means on the outside of the body, which is why that one's lateralis. And again, that causes extension, straightening. And finally, I want you to know that this one here is what's called your vastus medialis. Okay, your vastus medialis. Okay, so this vastus medialis again performs the same role. It contracts and straightens the knee. Now, the only point I want to make on top of that, literally on top of that, is we also have another big muscle which comes down in this area here, and this is called your rectus femoris. Excuse me, your rectus femoris. Okay, and this muscle is the fourth of our quadricep. Okay, so just be aware, I sort of move that to reveal the other muscles underneath. So this deals with our extension. So what then about our flexion? How do we actually bend the knee? Okay, now we're going to have a look at this image over here. And flexion occurs through the contraction of the hamstrings, which act as the agonist. And of course, it's the quadriceps that we've just had a look at that act as the antagonist, and we'll reverse that situation when we look at extension, of course. So we have three muscles within this hamstring group. This one here is just visible here, goes up like that, okay, and it pulls in that direction, and you can see here, if it pulls, it's going to bend the leg in this way. And that first of our hamstring muscles, which I'd like you to have awareness of, is what we call the semimembranosus. Semimembranosus. Okay, so the semimembranosus is what most people pronounce it as. This, of course, causes flexion to occur. Next one, let's have a look at this muscle here. This muscle here. Okay, this one here. Again, contracts, pulls upwards, and this time we refer to this as your semitendinosus. Your tendinosus. Okay, semitendinosus. And finally, we have this large muscle over here. This large one here. Again, contracts, pulls upwards, and this muscle is referred to as your biceps femoris. Your biceps femoris. Now, the only point I want to make in addition with regard to the hamstrings is notice that they actually originate on this part of the pelvis, or the ilium up here, and it's kind of like a strutting out part, and it's referred to as the ischium. And I think it's nice to know that because it's really like a levering, pulling machine. It kind of allows those muscles to pull from it to cause this flexion or bending of the knee to actually occur. And I think it's nice for us to know that. All right, so any action where the knee bends, think about leg curls, think about preparation phase for kicking something, think about extension being when we are straightening our knee, such as striking a ball, such as the strike phase of running, for example. All of these are powered by the quadricep groups and the hamstring groups, which you need to have a good awareness of. Now, let's finish off with looking at the ankle. So we're now interested in the ankle. This one, of course, is the left ankle over here. And again, we've got the fibula now, which is an articulating bone, the fibula, and we've got the tibia. We've got the tibia, which is this bone here coming down. Now, I've put it as a side angle because I also want you to realize that we have a couple of bones that articulate here. We have this bone here, which I'm shading in, which we refer to as your talus. Okay, so that is an articulating bone at the ankle. The ankle, by the way, which is also a hinge joint, so a monoaxial joint. But the other bone I'd like you to have a good awareness of is this bone here. This bone here. Okay, and this is what we call your calcaneus. Sometimes people call it your calcaneus. Your calcaneus. And of course, what we're going to see in a moment is that, again, this strutty kind of protrusion out here, this bit here, is going to be really important for muscle insertion. And I'm going to show you why that's the case in a few moments' time. So we've got a hinge joint This time the hinge joint does not flex and extend. It does something called plantar flex, plantar flexion, and it does something called dorsiflexion. I'm going to try and explain that to you in good clarity. All right, so we've got plantar flexion and dorsiflexion. All right, so let's see if we can address these points. So first of all, we have this large, let me just change color. We have this large sort of flat muscle which runs down the back of the calf here. And if you see here, inserts down on our calcaneus or our calcaneus. And this muscle is known as your soleus. Now, we normally don't refer to the soleus so much in the back of the calf because the one we tend to talk about is the muscle which sits on top of the soleus, which is this muscle here, which of course is the gastrocnemius. But both of these, notice, they both insert down onto the heel, the calcaneus, in the case of the gastrocnemius, through the Achilles tendon, which is this huge white structure here, okay, the Achilles tendon. And of course what happens here is when these pull, it pulls on this point here, and of course the toes then point downwards, and we refer to this as plantar flexion. So anything which involves the pointing of our toes, now you could think of sort of balletic moves, gymnastic moves, those sort of things, but just think about the time where you take off for a jump. You have to push your toes downwards towards the floor to propel yourself upwards through that ground reaction force. Well, of course, that's plantar flexion. And then what we've got when we have dorsiflexion, and dorsiflexion is when the toes start to point up nearer to the shin itself. We have a muscle called the tibialis anterior. And by the way, there is a tibialis posterior as well. But tibialis just means down the tibia, tibialis, and anterior, the front of the tibia. And this tibialis anterior, when it contracts up in this direction, of course, it pulls the toes upwards, and we refer to this as dorsiflexion. So again, you might want to think, right, sort of possibly the follow through after striking a ball with the foot might be dorsiflexion. But the thing I would really encourage you to think about is think about a landing position. When someone lands from a jump, their foot, if this is their lower leg, their foot ultimately ends up kind of, moving towards their shin. Even if it's their shin that's sort of moving downwards, it's a position of dorsiflexion, and that movement is controlled, albeit eccentrically, by the tibialis anterior. So landing from a jump, landing from a running action, that is an action of the tibialis anterior and is dorsiflexion in this particular example. Thanks so much for listening. Take care.